Welcome to True Health Tuesdays, and the truth will set you free. Let's get into it. Type 1 diabetes. And this was inspired by this question from Tony Powers. Is type 1 reversible as well as type 2 or just only type 2? Let's look at the causes of type 1. Now, type 1 diabetes, it used to be called juvenile diabetes or insulin-dependent diabetes. In this condition, the pancreas makes little or no insulin. And now, unlike type 2 diabetes, which is caused by insulin-resistant and faulty leptin signaling due to inappropriate diet and lack of exercise. So type 2 is more of a blood poisoning. People with type 1 diabetics do not produce insulin, and they must inject insulin several times a day if they are to remain alive. Now, let's look at the cause. According to the Mayo Clinic, different factors such as genetics, some viruses may cause type 1 diabetes. Although type 1 diabetes usually appears during childhood or adolescence, it can develop in adults. Even after lots of research, type 1 diabetes has no cure. Treatment is directed towards managing the amount of blood sugar using insulin, diet, and lifestyle to prevent complications. Please like this video and subscribe to our channel. It'll help us grow, and please share this information. This is life-saving. Again, according to the Mayo Clinic, the exact cause of type 1 diabetes is unknown. Usually the body's own immune system, which normally fights harmful bacteria and viruses, destroys the insulin-producing cells, the islet cells, in the pancreas, or other possible causes include genetic exposure to viruses and other environmental factors. It's those other environmental factors that are the main cause. Type 1 diabetes has an autoimmune disease in which the immune system destroys the pancreas cells that produce insulin. The rate of type 1 diabetes has increased dramatically over the past 50 years. Makes you kind of wonder what conditions could cause that, and what's changed over the last 50 years. Research has pointed to several nutrient deficiencies that contribute to the development of type 1 diabetes, especially vitamin D deficiency, and this is one of the keys. Now, contributing factors to type 1 diabetes, and this was 2009 study in Lancet, proposed 5 reasons why type 1 is on the rise. One, and we're going to go through each one of these: accelerator hypothesis, sunshine hypothesis, hygiene hypothesis, cow's milk hypothesis, and POP hypothesis. According to the accelerator hypothesis, children who are bigger and grow more quickly are more likely to develop type 1 diabetes. The sunshine hypothesis: data shows that countries that are situated closer to the equator have lower rates of type 1 diabetes. Very interesting. Hygiene hypothesis: a weak immune system from lack of a healthy microbiome may result in type 1 diabetes. That is huge. So what's destroying the microbiome? That would be a good question. Cow's milk hypothesis: data shows that exposing babies to infant formula containing cow's milk in the first 6 months of life damages their immune system, triggering type 1. Really? I wonder what type of cow's milk they're utilizing. Is it normal, healthy, organic, or is there hormones involved? And the POP hypothesis alleges that being exposed to pollutants increase diabetes risks. How are those pollutants getting in the system? Now, there are several more contributing factors not listed in the list article from Lancet, and we cannot discuss these factors here on public social media. Before 2019 we could, and hopefully in the future we can, but currently you have to go to the drbvip.com site, that's drbvip.com, where we can speak freely. Now, what can someone with type 1 diabetes do to improve their health? Great question. Remember, the quality of your life depends on the quality of questions you ask. Now, what controls the hormonal and immune systems? You've got the nervous system. And the nervous system regulates every function in the body. Now, you've got 2 aspects of this automatic or autonomic nervous system. parasympathetic, which is also called the rest, digest, and repair. And it's literally located in the cervical and the pelvis area of the spine. The sympathetic nervous system is the fight or flight nervous system, and it keeps you alive under stress. And this is vital. So when you look at your system, you have two switches in your body. One responds to stress. So this means you're running away from danger. So blood sugar elevates, blood supply to the gut shuts down. Your stress response shuts down your body's ability to regenerate, and also decreasing immune system function when you're in a chronic state of stress. Now, what does chronic stress do? Well, number one thing, elevated cortisol levels. And this is one of the stress hormones, along with adrenaline, epinephrine, norepinephrine, And what happens is when you're running away from danger, it literally stimulates the liver to break glycogen down to glucose, so blood sugar elevates. Protein synthesis decreases. That's because you have less blood supply to the digestive tract. Increased protein breakdown leads to muscle wasting under chronic stress. This causes a demineralization of bone that can lead to osteoporosis, interferes with skin regeneration, causes limp tissue, which is the sewer system of the body, to shrink, and diminishes lymphocyte function, cellular functions. And so when your body is adapting to chronic stress, this causes that hypersympathetic or sympathetic dominant state. And this is going to affect the digestive system, reproductive system, endocrine system, and the organs literally begin to break down from the lack of nutrients and blood flow. Adrenals become exhausted. Cortisol levels drop. Now, adrenals are the first order of the endocrine function to break down, followed by the insulin-producing portion of the pancreas, the thyroid, ovaries, parathyroid, pineal, pituitary, and finally the link to the autonomic nervous system, the hypothalamus. Now, 3 signals to dysfunction and disease. I love this: trauma, toxicity, and thought. Trauma. If you literally have a physical trauma, and this could begin at birth. I mean, just think C-section births have 4 times the amount of pressure on a child's neck. If the mom was given Pitocin or an epidural, this can actually cause trauma. So some of these traumas could be unidentified, but be contributing from birth on. And the only way to identify physical trauma is by looking at the structure. Toxicities, toxins, poisons can distort the signal's information on the path between the nervous system and the targeted cells. Tissues lead to the expression of dis-ease, lack of ease. Thought. Health is the nervous system's ability to accurately perceive environmental information and selectively engage appropriate life-sustaining behaviors. If a mind misinterprets environmental signals and generates an inappropriate response, a thought could be enough to undermine the entire system. Misperceptions can be lethal. That means that if you perceive something as stressful, that means if you're taking in stressful information, okay, your body is going to respond in that fight or flight state. There's only 3 stressors. And this is what all of my patients say. I say, look, your body is responding correctly based on the stress. We have to address the underlying stressors. And there's only 3. There's physical stress, chemical stress, and emotional stress. And these all cause your body to react to that correctly. So first, let's look at the proper nerve supply. Here's a patient of mine, and 1.5 years old. We can call him Tommy. Vacuum extraction at birth, so we know there could possibly be some type of cranial trauma, cervical trauma. He developed type 1 diabetes after the home was tented for mold. Okay, and now, so what is that? That's a chemical stressor and physical stressor. And you can see his gut that is a completely abnormal bowel gas pattern for a child. And now within 30 days, we reduced his insulin usage between 50 and 75%. Why is that? Because we're reducing the physical and helping with the chemical stressors by detoxing the system and getting healthy nutrients in the system, particularly bacteria. When you start developing, just like the Mayo Clinic says the microbiome may be damaged, when figure bacteria eat mold. And if he was just in a house tented with mold, that can be damaging the entire flora. Now, here's according to the Journal of Pediatric, Maternal and Family Health and Chiropractic. Now, a 4-year-old female with insulin-dependent type 1 diabetes was presented for a chiropractic evaluation. Now, exam, that revealed posture deviations, vertebral subluxations in the cervical, thoracic, and pelvic regions. This is huge because your body's ability to regenerate is located in the cervical and the pelvic areas. Seen for 24 visits, Gonstead technique protocol, great technique. Now, there was a significant decrease in hemoglobin A1C levels, which resulted in a lessening of the insulin administration. The chiropractic care of a pediatric patient with insulin-dependent type 1 diabetes is presented. More research is warranted in chiropractic care and diabetes because you're literally altering that physical stressor affecting the nervous system. Let's look at regular exercise. This is why we do the 5 keys to health. Exercise burns up the excess energy, and this is universal in type 1 and type 2. If you look at movement is a drug to the body. Exercise is a drug, and it's fantastic. You've got 4 detox pathways: respiration, perspiration, bowel movements, and urination, and exercise helps with all of those. But also, symmetrical exercise gets good stimulus to the brain, so it helps with brain function. Proper nutrition. This is hugely important. The solution is to repair the faulty blood sugar control. So this means that your metabolism is thousands of years old. You've got a hunter-gatherer metabolic body. So fresh flax oil. You don't want to have fresh flax oil can rancidify very quickly. Fish oil, and this means small fish, anchovy, mackerel, sardine, cod liver oil, until blood sugar starts to stabilize. Healthy oils such as organic, grass-fed butter. French butter is amazing because it still has good bacteria in there. Coconut oil, olive oil, clean animal fats such as not hormone-laden lard. Eliminate the cheap junk oils. No processed food, no restaurant menus. If man makes it, don't eat it. And a broad-spectrum mineral supplement, a plant-based mineral supplement. You can control the blood sugar manually during the recovery cycle. And this means start checking your blood sugar. Consume frequent meals, so this way your body always has that usable energy. Exercise regularly, okay? And this is postprandial exercise. Avoid sugars and for sure avoid alcohol. And eliminate toxic foods. Permanently remove from your diet all this toxic seed oils. And this means the corn oil, canola oil, cottonseed oil. I mean, these things are industrial byproducts. And junk fats, as well as the processed and restaurant foods. Now, for the last 50 years, the nutritional recommendations of a high complex carbohydrate and low saturated diet, and this is insane, for the American Dietetic Association, American Heart Association, and American Diabetes Association, their information is so bad. I mean, most of these complex carbohydrates, such as potatoes, rice, cereals, pastas, bread, rapidly convert into sugar or glucose and the long-chain saturated fatty acids. With recommendations, this incidence of diabetes and obesity has skyrocketed and become one of the worst worldwide epidemics the world's ever seen. Now, the main purpose of insulin is not to lower blood sugar. Okay, so by cutting the carbs, you cut the insulin, you ease the pressure on the pancreas. Insulin's major role is to take the energy, glucose generally, out of the blood and store it in the liver, or its job is to knock on the cell door, the cell opens up, and glucose rushes in. Insulin lowers glucose, had a side effect of directing that energy for storage or into the cells. A small amount of glucose is stored as glycogen in our body, but the majority is our main energy is stored in fat. Now, I love this, the nutrients in the European publishing. Our study confirmed that ketogenic diets were more effective in improving metabolic parameters associated with glycemic, weight, and lipid controls in patients overweight or obesity, especially those with pre-existing diabetes, as compared to low-fat diets. You need healthy fats. This effect may contribute to improvements in metabolic dysfunction related to morbidity, mortality in these patient populations. Healthy fats are amazing, okay? And this supports hormone production. Without good fats, you can't produce healthy hormones, skin regeneration, omega-3s, and you can get these from healthy animal fats, healthy animal sources, small fish, anchovy, mackerel, sardine. Palm oil, palm oil's good, but it's not good for the environment. Coconut oil, olive oil, organic grass-fed butter, amazing, because it gives you the ability to produce good hormones. Magnesium is amazing. Magnesium supplementation appears to have a beneficial role and improves glucose parameters in people with diabetes. And again, this is out of the European Journal of Clinical Nutrition. In conditions in people with high risk of diabetes, magnesium supplementation significantly improved plasma blood glucose levels. It's fantastic. And vitamin D, super important. And this is out of the complementary therapeutic clinical practice. This meta-analysis suggests that vitamin D supplementation improves glycemic index controls. Another one out of clinical nutrition. This study demonstrates that vitamin D improves serum levels of cholesterol. Amazing. And you get it from the sun. And there's also great food sources. Type 1 diabetes is virtually unheard of if you're closer to the equator. Receptors that respond to vitamin D have been found in nearly every type of human cells, from your bones to your brain to your pancreas. And according to Dr. Michael Holick, one of the leading vitamin D researchers in the world, children receiving vitamin D supplementation from age 1 on, listen to this, had an 80% decreased risk of developing type 1 diabetes. Also, look at the food sources for vitamin D. According to Advance in Expert Medical Biology, the immune system has evolved to protect the host from microbial infection. Nevertheless, the breakdown of the immune system often results in infection, cancer, and autoimmune diseases. Multiple sclerosis, rheumatoid arthritis, type 1 diabetes, inflammatory bowel disease, myocarditis, thyroiditis, lupus, erythematosus, myasthenia gravis, and organ-specific autoimmune diseases that affect more than 5% of the population worldwide. Curcumin inhibits these autoimmune diseases by regulating the inflammatory cytokines. These are cells that respond with inflammation. It really, sufficient rest. So diet vital. Let's look at rest. What does lack of sleep do? And you're looking at a significantly sleep-deprived society. Cardiovascular disease, diabetes, cancer, obesity, memory loss, multiple sclerosis. Why is sleep so important? This is your regeneration phase. Figure your body only has 2 switches. You could be in a stress state or regenerative state, sympathetic or parasympathetic. If you get good sleep, and this is your regeneration cycle, this should be the most important part of your day. It increases wound healing, activates your immune system, maintains emotional balance, increases the efficiency of antioxidant mechanisms, increase waste clearance of the brain, restores your ATP production, and this is on a cellular level that gives the cells energy. Secretion of growth hormones, increases clarity, memory retention, supports higher cognitive functions, prevents a lot of degenerative diseases. And drugs that affect sleep, blood pressure drugs, beta blockers, ACE inhibitors, diuretics, appetite suppressants, antacids, all the high blood pressure meds, ADD, ADH drugs, over-the-counter cold medications, analgesic, corticosteroids, sedative medication, sleep-inducing medications negatively affect sleep. Antihistamines. I have a number of pharmacists that wouldn't touch an antihistamine with a 10-foot pole. It's asthma medications. We're in a psychotic system that looks at your body's response to stress, and then they give a medication or chemical to control your body's response to stress. That's just 100 years from now, I think it's insane. Now, let's look at prayer and meditation. The best one is breathing. The 4-7-8 is one of the greatest, because when you're breathing, remember, you got 4 detox pathways: respiration, perspiration, bowel movements, and urination. Respiration is it. Sit up straight. When you breathe, your diaphragm comes out. Your tummy should come out. This way you're utilizing the bottom 2/3 of your lungs. Place your tongue back of the front teeth. Okay, breathe silently in through your nose for a count of 4. 1, 2, 3, 4. Then hold your breath for a count of 7 so you can get all of that oxygen in, and you can fill up those red blood cells with carbon dioxide. And then exhale through your mouth to a count of 8. Now do this at least 4 times. And when you get good at this, do this multiple times throughout the day. Just breathing will oxygenate your brain and help your system relax. Breathing reduces mental and physical fatigue, improves blood circulation, stimulates your parasympathetic. That's the rest, digest, and regeneration method. Helps eliminate toxic waste, strengthens your immune system. And this is why when you're breathing out, you're not just breathing out CO2, you're breathing out cellular exudates. This is why we talk about the 5 keys to health. If you're doing these things, then your body has the best chance to regenerate. Knowing that this is a blood toxicity and damage to your cells, if you can start to regenerate those cells, that means you're looking at the physical, chemical, emotional stress. You look at the nerve supply, regular exercise, proper nutrition, eating stuff that you're going to metabolize. So your diet is just like your great-great-great-grandfathers and mothers. Sufficient rest and prayer and meditation. If you do these, you're going to see your entire metabolism change. So please, now put all of your questions down below. We're going to get to as many of them as we can. We do have to divide these questions up into stuff that we know can get through the standard social media. But God bless you all. You are made in the image and likeness of God, and you are designed to live on this planet. So take care of yourselves and share this information. God bless you all.